Hi, everyone. I'm Colette. I am the director at Missouri Family and Family, and today we are going to chat a little bit about dual eligibles through part of Missouri's Open Door Benefit Series. It's sponsored by the Improvements for Patients and Providers Act, which is MIPA. There's priorities 1, 2, and 3. We are part of the MIPA 3 priority. So we have our partners here from Missouri SHIP, Missouri Department of Health and Senior Services, and UMKC, the Institute for Human Development. So this is part of a larger initiative called the Missouri No Wrong Door. It's transforming the way people access services in the community, support individuals and caregivers to make decisions on complete and accurate information about their options for anyone seeking long-term services and support, regardless of age, income, or disability. So I want to talk a little bit about enhancing integrated supports. If you're familiar with Charting the Life course, you might be familiar with this concept, which is the person using integrated supports in their community and the way that of their choosing. So to talk a little bit about the integrated support star and the layout of this series, when we think about integrated supports, we want to consider the person's personal strengths and assets, their relationships, the technology that they may use, and then things in the community that they might access, such as business, parks, schools, and faith-based communities. At UMKC, we have 2 different series that focus on different points of the star. There is the Missouri Open Door Technology Series, and that series explores different types of technology and the ways that it supports people. This series is the Missouri Open Door Series, and it really drills down and focuses on those eligibility-specific supports. And today we're going to be hearing from Gary, and he's a great presenter. And I'll let you hear from him a little bit more in a second, but I want to finish kind of explaining these open door series to you. So the Missouri Open Door Benefit Series occurs on the second Wednesday of every month from 12 to 1:30. Our next session is September 13th, and it's Medicare Prevention and Wellness Benefits. And then October 11th is Medicare annual enrollment and the importance of drug plan comparison. So please go ahead and put a save the date on the calendar for those upcoming events. Those are going to be very beneficial, and you will learn a lot from Gary around how to really think through open enrollment, the importance of drug plan comparison, and really what those wellness benefits are. So please mark your calendar for those coming up, because you'll learn a lot from those. The other series is the Missouri Open Door Technology Series. That one occurs the 4th Wednesday of every month. It's also from 12:30 to 1:30. And the upcoming sessions for that is August 23rd, Supports for Aging, September 27th, Universal Design, October 25th for AT for Employment, November 15th, AT for Hobbies and Pets, and the 20th of December is canceled, probably because of a lot of vacation and holiday things. So I'm going to turn it over to Gary. He is the Missouri expert around Missouri SHIP and State Health Insurance Program, Assistance Program. So go ahead, Gary, and I'm going to mute myself and turn my camera off.
Okay, thank you, Colette. As Colette said, my name is Gary Gumbig, and I am a member of the Missouri SHIP Strategic Outreach Team. And this team is really kind of focused on reaching more Missouri beneficiaries and clients with Medicare and Medicaid information. Helping me today is Sonia Baskarin, and so she's on keyboards, and she's making sure I keep moving quickly enough on my slides and that I don't dawdle over any of them, and she'll correct me when I get something wrong. So I appreciate all that Sonia does for Missouri SHIP. One of the things that before we go forward, you might have heard us as Missouri Claim in the past. We recently rebranded to Missouri SHIP, the State Health Insurance Assistance Program. And so all 50 states have a SHIP. Missouri is no outlier to that. So we just thought it made a lot more sense to be branded Missouri SHIP. So if you hear that and wonder where claim went, now you know, you're in the know. So All right, Sonia. So here's what we're going to try to accomplish today. First, just really understanding what a dual eligible is, and different kinds, full eligible, partial eligible, the requirements for becoming dual eligible. We're going to go over those, the benefits of being dual eligible, and kind of certainly a big deal right now is maintaining that eligibility. And we're going to talk around what FSD, the renewal process to make sure that nobody falls through the cracks, that they know what's expected. So we'll talk a little bit about that, and then special needs plans for dual eligible. So we're hopeful to get those items covered today. So just a little bit about SHIP and what the counselors can help with. Colette mentioned open enrollment and drug plan comparisons. Certainly open enrollment's kind of our Super Bowl at SHIP, where we receive the majority of calls. I mean, people are turning 65 every day, but during that period of October 15th through December 7th, that's really the crunch time for us. And we help a lot of people with their enrollment, their drug plans, evaluating Medicare Advantage plans, and of course their prescription drug plans. So, but in addition to that, we work with people on appeals, public benefits, Medigap plans. A lot of it really revolves around education, and that's why we were very happy to partner on this series just to talk about Medicare topics. Okay, so Missouri SHIP, we talked about State Health Insurance Assistance Program. It was created by Congress as part of Medigap reform. And as we said, we provide Medicare education. So a lot of times we'll have companies or organizations call and say, hey, we've got a big group of retirees that are getting ready to retire or want more information. Can you come and do a Medicare 101 for us? So that's something that we look forward to. You can reach out to our contact center and request, or our website, and request a speaker for that. So we're happy to do that. We do give feedbacks to CMS on state and local problems that we come across. And probably the most important thing to note, and why people really like us, is the counselors don't sell or promote any insurance company or its products. So we are unbiased. We look at the needs of the individual or the beneficiary, and we explain to them what options are out there, what the pros and cons are, and they make the decision. So we don't make those decisions for them. We just give them the options in hopefully straightforward fashion. Okay, let's go ahead and dive into the dual eligibility. So I thought the first thing, probably we just needed a definition. And really it's pretty simple. It's individuals who receive both Medicare and Medicaid benefits. So that seems pretty easy. So both Medicare and Medicaid do cover a lot of the same services, but Medicaid's going to go deeper than Medicare. So it's going to cover some of those long-term programs that Medicare may not cover. And so when we look at this, we'll explain some of that overlap and kind of who pays first and that sort of thing. So, typically Medicare is going to pay first if it's a Medicare covered service. So that's an important phrase there. So the Medicare covered service. So like if it was nursing home coverage, which Medicare doesn't cover, certainly they're not going to pay first just because they're dual eligible. Medicaid would be covering that. So, and depending upon whether you have an Advantage plan or a special needs plan or traditional Medicare, it kind of differs on how the coordination works. But really together, the two programs are really designed to help the very limited income Medicare beneficiaries from some of the extreme cost. I mean, the average cost of a private room nursing facility in 2021 was $108,000. Clearly, I think the average annual income for a dual in Missouri was, or nationwide, I should say, was around $20,000 or less. So clearly $108,000 nursing home bill and the $20,000 annual income just don't match up. So these two programs really help those in need to be able to afford that care. So the benefits of being dual eligible. So again, Medicaid's needs-based program, and it is funded jointly by the feds and the state. It really supplements Medicare. And it can do that in a variety of ways. It can help with the Medicare premiums. It can help with some of the co-insurance, co-pays, any of those cost-sharing requirements. And then, as we talked before, it helps pay for those services that aren't covered by Medicare, whether that's nursing home, whether that's dental care that's not covered, extended home care and personal care. None of that is really touched by Medicare. So that's where Medicaid comes in to help the dual eligibles get that service they require. And the other big thing is a big benefit of being dual eligible, in addition to just the financial aspect, is, for the most part, having a better choice of providers than just Medicaid. Not all providers take Medicaid, and so the beneficiary or client has a better choice of providers if they're a dual eligible. So that's great. So I thought it might be interesting just to kind of have a little chart here that, over 207,000 Missouri beneficiaries are dual eligible. And so the primary coverage is through Medicare. And then after that, they get assistance from Missouri Health Net or Missouri Medicare. And so you can see there that on the Medicare rolls about 1.26 million and the Medicaid 1.45 million. And duals kind of make up that middle ground or that overlap, as you see with the two circles, about 16%, just a little over that. So even though it's 16%, or like say a little over 16.4, they account for about 33% on average of the Medicare spending and 32% of the Medicaid spending. So it's a bigger chunk of the spending comes from the dual eligible. And I saw a note here: is Medicare available even if you're not yet 65? Yes. That's a good question, because if you've been on SSDI or disabled for over 24 months, you're eligible for Medicare at that point. And a big portion of the duals are actually part of that number or population. And I want to say it was about 40% are actually because of they're less than 65 years old because they've been on SSDI for over 24 months. So it's good question. So the requirements for being dual eligible, or as they're typically called, duals, they're enrolled in Medicare Part A and or Part B, Medicaid full benefits, and or they are participating in a Medicare savings program. And we've gone over Medicare savings programs in past seminars. We'll touch on some of it today, just really the requirements for it. But those programs, cover costs like the Part B premiums, Part A premiums, deductibles, co-insurance, co-pays, depending on the program. So those are a key part of that. And that's a lot of what CHIP does too, is we help qualify people for some of these Medicare savings programs and get people on the path to having better health coverage. So as we talked about before, duals can be in two groups, partial or full, depending upon the level of Medicaid benefits. Sorry, I'm reading the question, and I may ask Sonia to kind of field some of the questions that come through just for kind of a stream of consciousness here, so we don't so I don't come up and get sidetracked. So we'll come back to some of these questions as we're wrapping up, if you don't mind. So again, duals, two groups, whether it's full or partial, and that just depends on the level of Medicaid benefits that you get. So partial Medicaid pays for some of the expenses they incur under Medicare. And a lot of that is the premium and some of the cost sharings that come from the MSP programs. So that's kind of where the partial comes in at. So not full Medicaid, but they do get some relief as well. So full duals. So in addition to those benefits that come from the MSPs or the Medicare savings programs, full duals are entitled to Medicaid coverage for things that Medicare doesn't cover. And again, that typically deals with some of the long-term care issues that a lot of these duals have, because a pretty high percentage of the duals have some pretty severe health issues that they're dealing with. A lot of times they've already paid out a lot of money and paid down their savings in order to, try to handle those medical issues that they may have. So that's how they got into a position where they can qualify for Medicaid. So the duals with limited income and assets, and again, there's an asset and income requirement that we'll talk about, can get that full Medicaid benefits. So it's a good program that really provides excellent health care. So let's take a quick minute and test your knowledge. So who's going to pay the medical claims first for dual eligible Medicare covered services, Medicare or Medicaid? So go ahead and use your polling on Zoom and let's see what we get. Okay, we're kind of split. So if it's a Medicare covered service, Medicare is going to pay first. So I didn't do a very good job of explaining that earlier, is what this slide is telling me. So I apologize for that. But yeah, if it's a Medicare covered service, yeah, Medicare is going to pay first. So that's where we're at on that. So we'll close that out. Okay, let's talk a little bit about the eligibility on Missouri Medicaid. So as you see here, and that was an earlier question, I think, too, is who can be eligible for Missouri Medicaid. You can see a lot of different categories. Seniors age 65 and older, so they've aged in to the program. A parent or caretaker with a child under 19, a woman 18 to 25 with no health insurance, and you can read these. So you see a lot of categories here. And in addition, as Sonia pointed out, that we talked about a little bit before, if they've been on SSDI for 24 months, they can get on Medicare, and if they have the income limitation as well as asset, they can get on Medicaid as well. So a lot of ways to become eligible. So here's the, kind of where the rubber meets the road, if you will. So we talked about full duals and partial duals, and the fact that the partial duals get some help or qualify for one of the MSPs shown up here. So qualifying individual, SLMB, specified low income Medicare beneficiary, qualified Medicare beneficiary, and then MoHealthNet or Missouri Medicare. So you'll see there's an income requirement as well as a resource requirement. And as you go from left to right on this chart, certainly the Missouri HealthNet is the strictest, if you will, as far as the income and the asset requirements. At single, about 1,033 as far as monthly income, and the couple 1,397, and then the resources as well. You'll see 5726 or 11,452 for a couple. So you can kind of, when you're looking to see if you are qualified for Missouri Health Net, or if you're working with a beneficiary or a client, this chart comes in pretty handy to kind of see where they land on that chart as far as income and resource guidelines. And there are not all resources are counted, like your primary residence and a car and a certain amount of death benefit from a life insurance policy. So there are certain things that are excluded from that resource guidelines, but in general, at a high level, this is what you're looking at for that. So how do we apply? Couple of ways, and so this is for people that have computers, don't have computers, maybe visually impaired, that sort of thing. So there's all sorts of different ways to apply. So Missouri has an online portal that you can access and apply electronically. You can call them on the phone, and you can reach them at the number shown on this slide. You can call Missouri SHIP, and we can help you apply for Missouri Medicaid as well. We talked about the earlier aspect of this, that's a lot of what Missouri does. Missouri SHIP does is we help people qualify for Medicaid and eligibility for Medicare. Or you can do it the old-fashioned way and download, print, or scan the application as well. And I've got the link there that you can apply for Missouri Medicaid. So, and these slides will be sent out. I think that was an earlier question. The slides will be sent out, so you'll have these numbers and the URLs as well. So, we talk to a lot of clients, and as we're helping them qualify, they may not qualify for a program that they were initially after, just because of the income or resource guidelines. But the nice thing about when you apply for Missouri Health Net is DSS does check for eligibility for other programs. And we've listed some of those programs here. So you might not be Medicaid eligible, but you may qualify for a Medicare savings program like QMB or SLMB. And the nice thing about it is one application and you get checked for, are you eligible for Medicaid through a spend down or their ticket to work program, HCBS, which I think that there may be another program seminar coming in that in the near future. And again, Health Net nursing home coverage, Aid for the Blind, Show Me Healthy Babies, and there's probably more than this that they check for. But it is very nice that one application gets you kind of checked and, from an eligibility standpoint for a lot of other programs that may help that you were unaware of when you applied. So FSD is in the process of really doing the eligibility check for Missouri Health Net. They started on April 1st, 2023, and I just clipped a little bit of their website here at the right for their eligibility. And you can see that, and again, we're going to talk a little bit about it. It's really important to make sure your information is up to date with FSD. And when I say information, your address, your contact information, because, as they go through this eligibility, they're checking to make sure they can get a hold of you, in addition to, checking resources and that sort of thing. So it's key that your information is up to date. So keep that. If there's any changes, report it there. Watch the mail, because you should be seeing that annual renewal form or letter in the mail. So make sure you get that, you complete any information that they're asking, you get that back to them. Because doing nothing is a great way to get kind of knocked off the Medicaid program. So they need to know your information and have that updated. Okay, Sonia. So, and the reason why we just put this in here, this little bar graph, is just to show that on Medicaid, you know, pre-COVID, 3/1/2020, you see about 900,000 people on Missouri Medicaid. With some of the expansion and with COVID, no renewal checking or anything that went on, March of 2023, that number was closer to 4.4 million. What the estimates are after the 2023 renewals, it'll drop a couple 100,000. And some of that, unfortunately, is due to people not updating their information, that people not paying attention to the administrative part that they have to respond to FSD with. And so, again, I can't stress enough, if you work with clients, you know, encourage them to get that information back to FSD in a timely fashion, because doing nothing isn't really what you need to do. So the annual renewal for Medicaid is due during your anniversary month, so the month when your coverage first began. And if you don't remember when that was, you can log into the benefit portal there, put in some of your information, and you'll find out when the renewal is due. So if you haven't gotten your renewal notice yet and you were kind of wondering when that's coming, you can get that through their portal. Okay, so this is just kind of a sample annual renewal process if it was due in June. So, and again, I got this right off the FSD website. So if you want to look there, that's where this came from. You know, first thing is the address check. So they're going to check to see if they have a good address for you. And then they're just looking at the eligibility requirements, seeing if they can determine it from information that they already have. They mail you a decision letter or a pre-pop form if they needed more information, and then you just need to return that form to get your Medicaid approved and that decision made. So that's just kind of the sample timeline that you'd go through. So again, if we stick with the June kind of time frame, first scenario is, again, they're checking that information. FSD is checking the information they currently have, and they have a tool that helps them analyze that with this Insight engine. So, and maybe they can see that they have everything they need to continue your health net benefit. They mail a decision letter to Sarah, either saying she's eligible and she doesn't need to do anything, or she's not, and she has 10 days from the day to submit an appeal. So there is an appeal process as well if you think they've come to the wrong conclusion. Okay, let's go to scenario 2, Sonia. So scenario 2, again, same date that the renewal is due, June 30. So they're, again, checking the information just like they did before, using their tools that they have. And again, they're going to send you that pre-populated renewal form 55 days before your renewal's due. The person needs to complete the form, sign it, and provide copies of verification documents. And if she doesn't meet the deadline, she's going to get a letter from FSD. So they don't have to close their case just quite yet. And so again, we go back to really important to watch your mail and to return it on a timely basis. So after FSD gets the annual renewal, they're going to process it. They're going to mail the decision letter, and she's either eligible or not eligible. And again, she'll have the time frame to appeal a not eligible decision. So pretty simple process, really. So let's test your knowledge again. So if you're currently on Medicaid or Missouri Health Net, you should update your address with FSD send back any information in a timely fashion, confirm you qualify for dual eligibility, or all of the above. Okay, let's see what we got on our results. All of the above. Excellent. Yes, that's exactly what you need to do. So good job on that. Okay, let's talk a little bit about the choice for dual eligibles. So Medicare plus Medicaid. So if you're a dual eligible, you can choose Original Medicare or Medicare Advantage, either one. Some people like the benefits of Original Medicare and a drug plan as well. So, you know, you can, sorry, I'm trying to X out some of the things there. So you can choose Original or Medicare Advantage, either or. And we'll also talk about a special needs plan as well. But on the supplemental coverage, if you have Medicare and Medicaid, supplemental coverage from like a Medigap really would not apply in that case. Your Medicaid is really providing your supplemental coverage in that aspect. So, but Medicare Advantage, some people like the kind of everything roll into one nice tidy package. So that works as well. So the special needs plans are really pretty popular when it comes to dual eligibility, and really the DSNPs or dual special needs plans, they're for people eligible for both Medicare and Medicaid. And it really is good because they are designed for either their unique health conditions. They're designed to work hand in glove with Medicare and Medicaid. So that coordination of benefits is really important and built into those products. So they really made it pretty convenient on the special needs plans to accommodate duals and everything that they're going through. So, so those coordination of benefits is really a key part of those special needs plans. So the DSNPs tend to offer the most comprehensive set of health benefits on all the Medicare plans. And probably the streamlined experience is one of the big things we hear that the duals like about that, is because they just have to worry about their DSNP plan, and everything else is kind of happens, the coordination, if you will, kind of happens behind the scenes because that's the way the plan was designed. So, you know, the thing that you have to remember is with the DSNP plans as well, that you're going to be in the network that they subscribe to. So you have to make sure, again, as we counsel people, we talked about during open enrollment, and this applies with duals as well. Make sure you can go to the doctor that you want to see. That's kind of one of the number one things that we encourage people. Are your doctors in network? Can you go to those doctors that you need to go to? So that applies with DSNPs as well. So again, at a high level, you get that coordination between Medicare and Medicaid, usually zero monthly premiums. You get the over-the-counter benefits, dental, vision, hearing. Transportation tends to be a big one for the DSNPs. And a lot of that is because we talked about there's a pretty high percentage of people in DSNPs that are in very poor health, which sometimes equates to not having transportation to get to your appointments. And so some people look at DSNPs, I don't want to say solely for the transportation, but that's a key part of what they're looking for in a DSNP. And again, one plan doesn't fit all. So when a SHIP counselor works with a beneficiary, we have a conversation about what's important to them. And we try to kind of make sure that, like you see gym memberships down there at the bottom, that would be a nice to have, but probably not one that should rise to the top or would rise to the top of a decision tree for someone that's in a DSNP. there's probably more pressing issues than a free gym membership. So we try to kind of help explain and really just listen, and then search out for the DSNPs that make the most sense and present that to them. Or if they want to do traditional Medicare, as we talked about, they can do that. So this is just got a few screenshots here of Medicare.gov, which we use really exclusively when we're helping people with looking at the plans and their zip code throughout the year. And this is just a screenshot, and I just showed there at the bottom right with the big blue arrow that you can filter for plans for people who have both Medicare and Medicaid. And so those special needs plans are out there. And since there are so many plans out there, 40 plus plans out there, when you're working with somebody that's a dual, it's nice to be able to kind of limit the selections that you see so that they apply for what they're looking for. So I'd encourage you to use the screening mechanisms in Medicare Gov to kind of get down to some of the duals that are offered. And go ahead, Sonia, to the next one. And you can see that's just kind of the next screen. So it shows that it is for plans that for people that have Medicare and Medicaid. And it brought up one here that I just kind of hid the name a little bit. And you can see that on the plan benefits at the right, it's showing, yes, it has vision, dental, hearing, transportation, fitness. It's a 0 monthly premium and that sort of thing. So, and these are sorted by their lowest drug and premium costs. So it's easy to compare across all the DSNPs. You can compare 3 at a time and show them kind of how the plans differ. And so that's a big benefit and be able to present clearly what the options are. And again, here's more information on that comes up. And you can see the deductibles, health deductible of 0, drug deductible of 0 down there. In this case, it's showing 0 for the drug cost. I can't remember what drugs I put in there, but again, you can see the copays over there, and the in-network cost at $2,900, which the maximum they would pay for health services in this DSNP plan. So again, a lot of good information out there using Medicare Gov. It's a great tool to help. So just in summary, duals, our definition was individuals who receive both Medicare and Medicaid. Pretty simple. And they're designed just to help the limited income Medicare beneficiaries from out-of-pocket medical and long-term costs. So again, they work hand in glove with each other, Medicare and Medicaid, to cover the majority of those costs for the duals. The DSNP plans out there for Medicare Advantage are good, and they do make it pretty seamless to coordinate those benefits between Medicare and Medicaid. And lastly, but not the least important, certainly, I'd say it's critical for your beneficiaries to respond to these renewal requests in a timely manner. I know some people think, if I just don't answer, maybe this will go away. And unfortunately, it kind of goes the other way. So we don't want them to lose their eligibility. So encourage them to respond to those requests. If they're having trouble, they can call a SHIP counselor and we'll help them fill out that paperwork and get that back to FSD. All right, and we're at the question and answer period.
You had 7 questions come in the chat.
Okay.
I put them in order, but the first question is, was asking in relation to what you're speaking to. It says this applies for SSI as well as for those who are eligible for SSDI as well. Is that correct? So they were asking for a little clarification around the eligibility piece you talked about.
Okay, Sonia, let's go back to my eligibility slide if you can. But what I was talking about, or what I thought I was talking about anyway, was the eligibility for SSDI. So somebody's that's been on disability to get on Medicare after they've been on SSDI for 24 months.
Thank you. Question number 2, it says, this person shares that they're a receiver of part of their husband's Social Security. Am I eligible for Medicare before the age of 65?
No, the 65, to my knowledge, the 65 age requirement for her to age in is still there.
Okay. Question number 3 says, why would a parent or caregiver for someone under 19 be covered, but not over 19?
You know, that's a question I probably can't answer. I would have to talk with somebody at FSD on how they came up with the age requirement with a mother with a child with a low income situation, what the rationale was on the age requirement. I can't speak to that.
Okay. Question number 4, if someone with disabilities currently has Medicaid and SSI, then becomes eligible for SSDI and Medicare, do they lose their Medicaid?
No, they wouldn't lose their Medicaid. Unless their payment, I guess. I mean, you'd have to look at, again, income and resources. So sometimes, you know, like people got a Social Security raise, if you'll call it that, you know, adjustment, and that puts some people over some of the income limits they were previously okay for in a Medicare savings program or Medicaid or something, and the increase in benefits that they got actually put them over the income limit. And that can happen with any payment from the feds. So that you'd have to keep an eye on that as well.
Thank you. The next question says, if a person with a disability is already on Mo Health Net, becomes Medicare eligible, should they also apply for extra help, or does FSD automatically do that? I'm not sure what this question means by extra help, but perhaps you do.
Sure. The Extra Help program is a program administered by Social Security. And basically it helps reduce the cost of your prescription drug plan. So it's a great plan. And there's an income and resource requirement for the Extra Help. The FSD should look at the Extra Help as well when they're doing the qualifications. They share that information across, so they should get it, but sometimes it happens, and sometimes, you know, there are times where it may not. So, but we at SHIP can help somebody apply for that or tell them how to apply for that as well. So again, half the battle is knowing what programs are out there. So sometimes it's like you don't know what you're missing because you don't know what programs are there. And so that's why we tried to list a lot of the programs on this particular presentation, just for awareness, to show that there are a lot of programs out there that the Missouri beneficiaries can take advantage of.
Great. The next question is, on the qualification of having SSDI for over 24 months, is that total or consecutive? I have a client that had an interruption of benefits due to moving to a new state.
You know, I wanted to say I would actually need to look this up because I'm not 100% sure. It's a great question. I want to say it's 24 months of continuous, but again, I can, before you send out the slides to everybody, I can get that answer. So I'll write that down as far as continuous or not. And it wouldn't take long for me to look it up, but I can't do two at once. So
yeah, thank you.
All right.
I'm sure that you'll appreciate that. And I appreciate so many good questions, really helping everyone to learn together.
Absolutely.
So number 7, is there any risk to not being able to qualify for waiver services based on the DSNP selected? The DSNP selected.
And I'm wondering what waiver services that they're interested in. I off the top of my head, I can't think of how that would be a problem, but that might be one where if somebody wants to email me after, you can do that, and I would be happy to respond, and you can share my email with the participants and they can send me questions as well.
So the next question is, there are so many great questions coming in, and we want to make sure that we answer them all. So someone says, can SHIP help my client even if they are unsure if they have Medicaid currently?
Yes. Yeah, I mean, we can work with them, and really it's as easy as going out to the state website, putting their information in there, and we can see what the state says they are on. It'll say if they're on Missouri Health Net or not. It'll say if they're on Spend Down or not. And thank you, Scott. I saw Scott Minnie, who's our executive director, put some information out there as far as how to contact, as well as Sonia.
Sorry, the screens got lost for me. I kind of panicked for a second. Yes, these are great questions. The next question was actually asking, how does someone connect with SHIP and how can they help? So Scott was intuitive and popped that right in the chat. The final 2 questions are, can DSNP be tailored to cover kidney dialysis cost?
Yeah, there are DSNPs out there that basically are designed for chronic illnesses, different chronic illnesses. And so you'd have to, the best way would be to look on Medicare Gov for that zip code and see what plans are available. But yes, there are actually, I should say, not DSNPs, but special needs plans out there, really CSNPs, that address chronic illnesses.
And then another person asked, is the Extra Help plan different from QMB?
Yes, the Extra Help is different from QMB. Extra Help deals with it. Well, number one, Extra Help is administered by Social Security, and it deals with helping lower your prescription drug costs. QMB is administered at the states, and basically that helps. QMB is a great program, qualified Medicare beneficiary, and that pays for your Part B premium. It could pay for your Part A premium if that's not already paid. It pays your copays, it pays your coinsurance. And so that's basically like I kind of compare it to a Medigap plan without a premium associated with it. So very good plan. So yeah, they're totally different, and one's after the medical costs and one's after prescription drug costs.
Okay, we've got two final questions, and then when we send out the email for this, like the email recap, it will have contact information for SHIP in there so that people can ask more specific questions about their specific scenario, whether it's for themselves or someone they're supporting. I do want to ask these 2 last clarifying questions because I think it will help people to understand when they should call SHIP and when it's something SHIP can help with.
Okay.
So the first one, I saw another one. I'm sorry. So there's 3. So one says, I'd like the question asked about moving out of state. Do you retain your dual eligibility?
There would be different, let me think this through. If you moved out of state and you were on a DSNP plan, that wouldn't be in the area that you were in anymore. So you would have to apply again for a different DSNP plan.
And the same would go for Medicaid. Medicaid doesn't transfer from state to state either. Right. So you would need to reapply for all those services. So another person asked, what if we have someone who's not on Medicare that just wants help completing the Medicaid application? Can they call SHIP?
They can. We do that all the time.
Okay.
Well, and Scott's got a little different answer there, so I might defer to him.
Okay.
So he's referring you to Cover Missouri
Mm-hmm.
with the phone number there.
Okay. So we will add Cover Missouri to the resources when we send out, and Scott says a SHIP counselor may be able to try to help, but that Cover Missouri may be a better resource for that.
Yeah, we do help people with application. What we try to do is not just pass people off to another agency. I mean, that's discouraging from a human standpoint, if you will, when you're looking for help, and then it's like, no, we can't help you, try this. And so we do try to help whenever we can.
Perfect. Thank you, Gary. Your final question before we launch the poll for everyone is a disabled person under 65 has SSI, Medicaid, and medical coverage under parents' work coverage. When the parent retires and moves to Medicare, would the person with the disability also get Medicare?
Yeah. Run that by me one more time. I think I got it, but it was a long question.
Perfect. It is a long question. So a person with a disability is under 65 and they have SSI, Medicaid, and medical coverage under parents' work coverage.
Okay.
When the parent retires and moves to Medicare, can the disabled person get Medicare as well?
No, not unless they are disabled for over 24 months. That wouldn't come into play. So Medicare coverage is on an individual basis, so it doesn't help a spouse or a child like that.
Thank you. I think we wrapped up our questions for today. This was a great amount of questions. I appreciate how engaged the group was. And I appreciate Gary going under fire and rapid answering a variety of questions. Please complete the survey and we would love your feedback, and please look forward to the recording and the update or the recap around this session. And please, if you know other professionals or family members or individuals in the state that would benefit from this information, please direct them to the recording so that and to the upcoming session so that they can get access and gain a better understanding as well.